Hi, I'm Kylie and I'm going to be doing my head to toe assessment today. Here is my 360 of the room. My proctor is here. My patient, no notes or anything. Okay, so I would walk in the room. I provide for privacy, so we have privacy in place. I've already performed hand hygiene, so hands are washed and clean. Then I want to introduce myself to the patient. Hi, my name is Kylie. I am a nursing student. Today I'm going to be doing a head-to-toe assessment on you. This is going to involve me inspecting parts of your body, palpating, feeling, doing a full head-to-toe assessment. Are you okay with this? Okay, so patient has consented to a head-to-toe assessment. They are alert, answering my questions appropriately, and they do not appear to have any outward abnormalities or disabilities that I would need to make accommodations for during my assessment. So I'm first going to start with a skin and hair assessment. This is so I can get a full look at the body before I start diving deeper into other body systems. Okay, we're going to start with a skin assessment. So for the purpose of this video, my patient's fully clothed, but I would want to look at all parts of the body. So I would first want to start with looking at the arms. I'm going to look at the chest. We'll look more into the scalp and the face in a second. Looking at the chest, the abdomen, going to the other side. I want to make sure that I look at their back if they're laying in a hospital bed, help them up, check all the skin on their back. Again, down to their legs. Any skin, I need to check for any abnormalities. While I'm doing this, I want to use the back of my hand to feel for warmth on the body, see what the temperature is. I'm also checking for any edema at this time, so any swelling. I'll just do that all over the body, and we'll also do this when we dive deeper into the other body systems. And then you also want to check for turgor. So I would do that by taking my fingers and pinching a part of the patient's chest, and that should bounce right back into place. So we did that. Turgor is resilient. So after a full skin assessment on my patient, their skin is white, normal for their ethnicity. It's smooth, warm and moist. There is no edema on the patient. There's no odor, no excess perspiration. There was one lesion visible on their right hand. So we're going to go ahead and measure that. Okay, so that lesion was on the dorsal side of her right hand, and it was a 2 centimeter by 2 centimeter plaque, and it was kind of dry and rough and flaky. Patient has female hair distribution. We're also looking for that when we're doing the skin assessment. So female hair distribution, no thinning of hair on the extremities or the body. There's no infestations on the body. Patient is hygienic and well taken care of. So now that we've done the skin assessment, we're going to check the nails. So I'm going to look at the patient's nails, and we're going to do this for both hands. Okay, so the nail plate is pink, smooth, hard and uniform. The nail beds are firmly adhered. The nail folds are free of any redness or lesions. I also want to check for clubbing of the nails, so I'm going to have my patient put their thumbs together like this for me. Okay, so no clubbing of the nails. Nail base angle is less than 160 degrees, which is what we want to see. And then I also want to check for capillary refill. Okay, we're going to do it on the other hand as well. Okay, any tenderness with that? No? Okay, no tenderness, and capillary refill was brisk, less than 2 seconds. I would also do the same assessment on the toenails, so we're going to pretend that I just did that. We're looking for same thing as we did in the fingernails, any clubbing, capillary refill, what the nail plate looks like, the color, if the nail bed is adhered. So we did that. And now we're going to move on to assessing the head and the face. So looking at my patient, her head is normocephalic, it's symmetrical and midline. Her face is round, symmetrical, there is no drooping. There's no involuntary movements of the face, no abnormal facial characteristics. Now while I'm looking at the face, we're going to go ahead and assess cranial nerve 7. So Lakin, I'm just going to have you follow my instructions, okay? I'm going to have you close your eyes super tight, open. I'm going to have you smile, frown, and puff out your cheeks. Okay, so cranial nerve 7 is intact. Then I'm going to go ahead and apply gloves, and we are going to do a skull, scalp, and hair assessment. Okay, so I want to palpate the skull. We're doing this in circular motions. Okay, so skull is smooth, there's no masses or depressions. Then I want to look in the hair at the scalp. Okay, and then we'd also check the other side. Okay, any tenderness at all? Okay, so no tenderness on the scalp, there's no skin breakdowns or lesions, no infestations on the scalp, and scalp is mobile. And there are, her hair is black, smooth, thick, evenly distributed, and like I said, no infestations, so hygienic. I would then take off my gloves and perform hand hygiene. And I'm going to put on a new set of gloves. Perfect. Okay, next we're going to assess the temporal arteries. So I first want to inspect them visually. So we're looking from both sides at the temporal arteries. They appear to be flat, no pulsation, no bounding, no arrhythmia. And now I want to palpate them, so I'm going to take 2 fingers and place them on the side of your head, okay? Okay, no edema, temporal arteries are firm and smooth. Do you have any tenderness right there? Okay, and then I also want to listen to the temporal arteries. And I'm doing this with the bell of my stethoscope. Okay, so no bruits are heard, which is what we want. Now I'm going to go ahead and assess cranial nerve 5. So I'm going to place my fingers on top of your jaw, okay? I want you to bite down. Okay, so I can feel that clenching, so cranial nerve 5 is intact. Also, while I'm here, we're going to check for TMJ. You can place my hands here again, and open and close. So open and closes smoothly, no crepitus or clicking, which is also what we want to see, so no TMJ. Now I'm going to assess your sinuses. So I'm just going to be palpating on top of your sinuses. If you have any pain, just let me know, okay? Palpating the maxillary sinuses and the frontal sinuses. Any tenderness at all? Okay, good. So now we are going to move into assessing the eyes. So first I want to inspect the eyes. I'm looking for the palpebral folds. They're present and symmetrical bilaterally. Eyelids are symmetric, free of any lesions, swelling, or redness. Eyelashes are in an appropriate position, no flaking. There's no ptosis present. Eyebrows are also an appropriate size, and there's no lateral thinning of the eyebrows. And the orbital areas around both eyes aren't puffy and are free of any lesions. So then I want to look at the conjunctiva. So to do this, I would pull down on the patient's lower lid and upper lid. So we're going to pretend I'm doing that. The conjunctiva should be pink, free of any discharge. And so we've done that. We've looked at the conjunctiva. We're also going to look at the sclera. The sclera is white. We're looking at the cornea, which is translucent. It is not continuous. The iris and the lens both have no irregularities. Eyes are green, and the pupils are round and equal. Now I'm going to palpate around the orbital area. If you have any tenderness, let me know. Okay, any tenderness? Okay, no tenderness, no edema, no masses or nodules felt in the orbital area. Okay, so now I want to check cranial nerve 2. So I'm going to have the patient hold the chart about 14 inches away from the face. Okay, so that's about an arm's length. And you're going to cover up one eye, and I want you to read the smallest line that you can see. You can just pretend you did it.
Read the number 1 line.
Okay, so patient has 20/20 vision. And then I also want to do a confrontation check. So I want you to cover up one of your eyes, doesn't matter which. Okay, I'm going to cover up the opposite eye with my hand. And then I want you to let me know when you see my fingers, okay? Just look straight at me.
See it?
Okay. So cranial nerve 2 is intact, and we have peripheral vision intact as well. Now I want to check cranial nerves 3, 4, and 6. So to do this, we are going to first start by checking for nystagmus. So this is an involuntary shaking of the eye. So what I'm going to have you do is I'm going to hold the pen light about 12 inches away from the patient's nose. I want you to keep your head still and just follow the pen with your eyes, okay? Good. So no involuntary shaking movements of the eye. We did this by checking the 6 cardinal fields of gaze. Now I want to check the corneal light reflex. So again, I'm going to have you stare off at an object in the distance. I'm going to turn on my pen light, and I'm going to be shining this into your eye one at a time. Okay, so this pupil that I just shined the light into constricted directly, the other one constricted consensually, and we'll do this on the other eye. Okay, same thing. This one constricted directly, the other one consensually. That's what we want to see. And then lastly, we're going to be checking accommodation. So I'm going to hold my pen about 14 inches away from the patient's nose. And I'm going to have you just follow the pen in with your eyes, okay? Okay, so we have accommodation. So cranial nerves 3, 4, and 6 are all intact, and we have perla. Now I'm going to look inside the eye. Visually, it's pink. So I'm going to clean my ophthalmoscope with an alcohol pad, just in case it were to touch the patient. And to do this, I am going to place my hand on their shoulder to ensure we don't move heads. Are you okay if I place a hand on you? Okay. We are looking inside the eye. Okay, so red light reflex is present bilaterally. The optic disc is cream colored with well-defined margins, and the vessels and the retina don't have any irregularities. And then I'm just going to clean this off before I put it back. So now I'm done with my eye assessment. Now we're going to move on to the ears. So I want to inspect the ears first, and we're going to do that on both sides. So I'm just looking at both ears. There's no redness, no drainage coming out of the ears. There doesn't appear to be any lesions around the ears. Are you having any pain in your ears or any drainage? No? Okay. Ears are symmetric and an appropriate size for the patient. Now I'm going to palpate the auricles of the ears. Okay, any tenderness at all? Okay, no tenderness, no edema, no masses or nodules felt on the auricles of the ears. Now I'm going to palpate the mastoid area. Any tenderness there? Okay, no tenderness on the mastoid area, and there's no masses felt there either. Now I want to look at the auditory meatus and the external canal, so I'm going to get my otoscope. Okay, I'm going to clean this off. Okay, and we're going to be looking inside both ears. Okay, so just looking at the auditory meatus and external canal, there's no foreign bodies, there's no excessive drainage, there's some yellow cerumen, an appropriate amount, and it's moist, but everything looks good there. And then I want to look further in the ear at the tympanic membrane. So to do this, I would lift the pinna of the ear up and back. And for this assessment, we're pretending to go all the way into the ear, and we do this bilaterally. Okay. After doing that, the tympanic membrane is pearly gray in color. There's a 7 o'clock or 5 o'clock light reflex on the right ear, 7 o'clock light reflex on the left ear. There's no bulgings or retractions, no perforations, and the umbus, handle of malleus, and short process are all visible in the ear. I'm just going to clean off my otoscope before I back. And now I am going to conduct a whisper test, okay? So I'm going to stand behind you, and I'm going to whisper 3 numbers, and you're just going to repeat back to me what you hear, okay? Okay, perfect. Okay, I'm going to have you cover up this right ear. Okay, and I want you to repeat what I say. 2, 4, 7. Okay, I'm moving to the other side. 8, 9. Okay. Perfect. So patient could hear. And now I'm going to do a Weber test. So I am taking my tuning fork, and this is also testing for cranial nerve 8. So I'm going to strike this and place it on top of your head. Nothing crazy, just some vibrations. Can you hear that equally in both ears? Okay. So cranial nerve 8 is intact, and there's no hearing loss indicated by the Weber test. Now I'm moving on to assessing the nose. So I'm just first going to inspect the nose. Its midline is appropriate in size. There's no visible displacement of the cartilage. Nose is the same color as surrounding skin. Then I want to, are you having any pain in your nose? Any excess drainage? Okay, so no pain, no drainage. I want to check for patency bilaterally as well. So I'm going to have you occlude one nostril and breathe in and out your nose. Okay, switch sides. Okay, so good airflow, nice and patent. And then I want to palpate the nose. So I'm feeling for any masses. Do you have any tenderness with that? Okay, so no masses, no tenderness on the nose. And then I want to look inside the nasal cavity. So I'm just going to look at the nostrils. Okay, so no drainage, no abnormalities in the nasal cavity. It looks nice and clear. So now I want to test cranial nerve 1. So Lakin, I am going to give you 2 different scents, and I just want you to tell me what you smell, okay? I don't even know what this is.
Peppermint.
Peppermint, okay. And the second scent.
Flowers.
Okay, good. So patient could identify both scents. So cranial nerve 1 is intact. Now we're going to move on to assessing the mouth. So I'm looking at the lips first, inspecting those. The vermilion border is symmetric. Lips are pink, they aren't chapped, no sores are visible. And then I would also want to palpate the lips, ask if they have any tenderness. Pretending to palpate, do you have any tenderness? Okay. Then I want to take we don't have a tongue depressor. Take a tongue depressor, and we're going to pretend to look inside the mouth. I would have them first open up, use my tongue depressor. I'm looking at the buccal mucosa first. Looking on both sides, it is pink, there's no lesions, no redness, no abnormal swelling or anything. I'm also looking at the Stinson duct, and by looking at the Stinson duct, there doesn't appear to be any abnormalities, and saliva production is observed. Then I would take my tongue depressor. I would want to poke the gingiva. I would ask if they had any tenderness. Do you have any tenderness? Okay. Gingiva is pink, no redness, no lesions. There's no signs of atrophy or hypertrophy. And then I'm also looking at the teeth while I'm doing this. So patient has 28 teeth. There's no signs of malalignment, malocclusion, caries, any loose or missing teeth. Then I'm going to have you stick out your tongue. I'm looking at the tongue, it's pink. I would also palpate the tongue at this time, look for any masses or nodules. So after pretending to do that, no masses or nodules. And then I also want to look under the tongue. So I'm going to have you lift your tongue up. Okay, there's no lesions or swelling under the tongue. And the Wharton duct also appears to have no abnormalities, and saliva production is observed. Then I want to I'm going to have you open and say ah. I would have a tongue depressor. I'm looking at the hard and soft palate. So the hard palate is dome-shaped and it's pink. Soft palate is smooth, also appears pink, no nodules or masses visible. And then I would go ahead and check cranial nerves 9 and 10. So to do this, I would take my tongue depressor, press down on the patient's tongue and have them say ah. So say ah. Okay, so uvula falls and rises symmetrically. So cranial nerve 9 and 10 are intact. While I'm having you do this, I'm going to go ahead and check cranial nerve 12. So I'm going to have you stick out your tongue, move it side to side, touch your nose, touch your chin, and then puff out each one of your cheeks with your tongue. Okay, so cranial nerve 12 is intact. Then I also want to check the gag reflex when I'm checking cranial nerves 9 and 10. So I would take my tongue depressor and elicit a gag reflex for my patient. So we're going to pretend I did that. So cranial nerves 9 and 10 are intact. Then I'm going to look at the tonsils as well. So looking at the tonsils, there's no redness, no swelling. 1+. Also, I'm looking at the posterior wall of the pharynx. It also is pink, free of any nodules or redness. Okay, did I forget anything? Okay, now we're going to check cranial nerves 4 and 7. So Lakin, I am going to have you eat this. Do you actually eat it? Okay. Patient ate it. Can you tell me what you taste?
It was sweet.
It was sweet, okay. And then I'm also going to have you taste this.
Sour.
Sour, okay. So patient was able to identify both types of taste. So cranial nerves 4 and 7 are intact. Okay, if you're okay, I'm gonna go ahead and remove my gloves. I'm just gonna be feeling your neck and lymph nodes from this point on, okay? I'm gonna take off my gloves, perform hand hygiene. My hands are sweaty. So next I am assessing the neck. So I first start by inspecting. So the neck appears symmetrical midline. Then I'm also looking at the trachea. Are you okay if I touch you? So trachea is in line with the sternal notch, which is what we want to see. I am looking at both sides for any masses, any jugular distension, any carotid prominence. Don't see anything like that. I also want to check for thyroid enlargement. So I'm looking from the front at the patient. Does not appear to be any thyroid enlargement. I also want to look from the side for this. So still no thyroid enlargement. And then I want to palpate the trachea and the thyroid. Okay, so trachea appears midline. Then I want to palpate each lobe of the thyroid. Okay, so thyroid is not enlarged, it's firm. It's about 4 centimeters. So thyroid appears to have no abnormalities. Then I'm going to have the patient swallow. Okay, so the thyroid and the hyoid bone both move when patient swallows. Now I want to check for an aortic aneurysm. So I'm going to have my patient stand up. I'm going to place my hands on your trachea. Okay, you can sit down. So no pulsations felt, no downward tug, so we're negative for a tracheal tug. Then I want to listen to each thyroid lobe. So same with temporal arteries, we're just listening for any bruise. And I'm doing this with the bell of my stethoscope. Okay, and check the other lobe. Okay, so no bruise can be heard. And then I also want to assess the carotid pulse, and I will do this one at a time. Okay, carotid pulse is regular rate and rhythm, 2+. So good. Now I want to do a range of motion test. So I'm just going to have you follow my directions again, Lincoln, okay? I'm going to have you look down, look back up at me, look all the way up, back down, look to the right, look to the left. I want you to touch your right ear to your right shoulder and left ear to left shoulder, okay? And then we're going to repeat this with resistance. So I want you to look down, look up, look to the left, look to the right, touch your left ear to your left shoulder, right ear to right shoulder. Okay, so patient has full range of motion, passive and active. Then I'm going to have you shrug your shoulders and shrug your shoulders again. Okay, so cranial nerve 11 is also intact. They were able to shrug their shoulders with and without resistance. So then I am going to palpate the cervical vertebrae. I'm going to be touching the back of your neck, okay? Okay, and I have located C7 and T1. It is a line, no edema, all seems normal there, no abnormalities. Okay, and then last thing I'm going to be doing is assessing the lymph nodes. So as I'm doing this, if you have any tenderness, you just let me know, okay? So I would start with the occipital, so I'm going to walk around. I'm assessing the occipital lymph nodes, the post-auricular, okay. And then I'm going to palpate the pre-auricular, okay, submental, submandible, and tonsillar, and then anterior cervical, and posterior cervical, and then supraclavicular, and we wouldn't want to do this over close anyways, and then subclavicular. And then I would also do axillary and inguinal, and then I'm going to do popliteal, and I'm going to have you stick out your arms like this for me, and epitrochlear. Okay, did you have any tenderness on any of your lymph nodes? Okay. No no tenderness, all lymph nodes were non-palpable, and no warmth, which is what we would like to see. Okay, I have finished my assessment. You're all good.